Well, good afternoon. Thank you all for coming out today. We really appreciate you being here today. I just give you a little agenda of what we're going to do. Let's have a little program here. I want to go ahead and introduce a few of the folks you're going to hear from today. My name is Cindy Samuelson. I work with the Kansas Hospital Association, and I'm honored to be out here today to recognize the program at the hospital. I will be introducing Tom Bell here in a moment. He's the president and CEO of the Kansas Hospital Association. And then Jim Wallmeyer is going to speak to us as well as Rose Colbert. So, Tom Bell, KHA.
Cindy, thank you very much. And really wanted to say, believe me, when I get introduced at my office, I don't get it. So I appreciate that. I want to thank all of you for coming today. This is an important program for us, and I know it's an important program for folks in this community. And I also want to say thank you to Kelly Kelsey, from Congressman Moran's office for being here. We appreciate you coming, but we also appreciate the support that Congressman Moran has shown to healthcare issues throughout his career. So, we started this Community Connections program a couple of years ago, and really what we wanted to do was to demonstrate that hospitals are much more than just a building that they're a big part of every community that they're involved in, that they reach out beyond the hospital, the building, and serve the community every day of the year, 24 hours a day. So what we wanted to show was how hospitals provide a significant benefit to the community outside of just the care that they give. And you know, if you're looking at programs that do that, what a great example you have here. This Christmas outreach program is a perfect example of this hospital, the folks in it getting together, reaching out to the community, providing things and resources for people that wouldn't otherwise be able to afford them, and proving that a hospital is much more than just the building that houses the beds and the nurses and the doctors and the patients. So we're very pleased to be here and are happy to award this honor to Cloud County Health Center. I wanted to officially say that we are giving our 2009 Community Connections Award to the Cloud County Health Center and their Christmas outreach program. Jim?
Thank you, Tom. The community annual Christmas outreach program was started clear back probably 30 years ago by Sister Frances Joanne, and Sister Julie was instrumental in it also. But in the last 5 years, it really took on a life of its own with the penny campaign and stuff. All the employees should be congratulated for the work they did. Especially want to thank Pam Campbell and Rose Colbert for helping getting that started. And Rose is going to tell you a little bit about the program and how it's been so beneficial to the people in the community. So, Rose?
Hi. For our guests' sake, I want to explain a little bit about the Christmas Outreach Program because all of our employees have participated for years. So, our Christmas Outreach Program is annually. We have done the penny jars just for the last 5 years, as Mr. Wallmeyer said. The penny jars is a friendly competition between staff and physicians and the clinic and the hospital employees to raise money. And all the pennies in the jar count for the positive. All the coins, dollars, and checks count towards the negative. So, believe it or not, all these penny jars do raise over $1,000 each year to adopt families. And the families that we adopt between 10 and 14 families a year, sometimes as much as 16 families. But for each of those families, we provide gifts for the children and quite a good amount of food for all of the family. And sometimes we use Christmas outreach funds throughout the year for other little things that come up, someone that's going home and cannot afford their medication or miscellaneous things. But we could not do this without a lot of support from all the employees of the clinic and the hospital both. And it is really a great endeavor that we're working together, departments working together and delivering, cutting out angels from the angel tree, counting the pennies. It takes a lot of hours, but it touches a lot of lives, and it makes a difference for those families that have had a rough year. That we try to identify families that maybe have especially had had a rough year this year because of maybe illness in the family, maybe it's a single mom, not always so, and maybe she's had some medical problems or symptoms going on. We try to help them, and if there's an employee that year that's had an especially rough year, we try to help employees through the Christmas Outreach Program. So it's been a wonderful working together of all of the people in the hospital, and I thank you so much for the Kansas Hospital Association for giving us this honor. That is a wonderful, awesome benefit to have this $1,000 to contribute to the Christmas Outreach, and it's quite an honor, and we feel very, very fortunate as a hospital to receive it. So thank you so much.
Well, we do actually have $1,000 to present to the Cloud County Health Center in a very large format. So if we can have folks come up and hold the check, that'd be great. I think that would be great. I'm going to take a picture, so I'm going to.
We've got plenty of room behind us.
Long way behind, right?
And you can come right up front.
Come on, Dave, your part. Good boy. Hi, guys.
Oh, wonderful.
Dave, get in the picture.
We need more employees. Come on.
Hi, Lori. Now, Rose, if you can hold the check down just a little, you can see everybody's faces. And Jim, yeah, if you can squeeze in, excellent. Right here.
Okay, here we go, everybody. Ready? 1, 2, 3. We're gonna do one more, okay? Right? Everybody ready? 1, 2, 3. All right.
And then wait. You want to go? We got 1, 2. Okay, 1, 2, 3. Thank you all. Appreciate that. You get to keep this check. And this check is a little hard to go to the bank. Sometimes they don't like that. So we actually have a real check back here that I'll give to Jim. I wanted to just, one last note, ask if there was any questions. Here's the actual check. There is a real check here. We had 62 hospital programs that came into the Kansas Hospital Association from 40 different hospitals across the state. And we selected one program in every district. And so it is quite an honor. We're so glad to be here to present the award and hope you too know that the work you're doing is making a big difference. So we have refreshments. If there's any questions from anybody, see Jim, see Rose, talk to Tom or myself, and have some refreshments. It's hot out, lemonade, and it's got ice in it, so I think it'll be enjoyable. So thank you all for being here again.